If you're an aesthetic practitioner, doctor or nurse, and you're looking for microsclerotherapy training to treat leg spider veins, you're in the right place. I'm going to explain what microsclerotherapy is, who can inject leg spider veins, and what areas of the legs can be injected. Towards the end, I'll tell you the #1 tip to avoid complications of microsclerotherapy. So let's jump straight in. What is microsclerotherapy? Microsclerotherapy uses a fine needle, hence the micro bit, to inject a prescription medicine called a sclerosant, hence the sclerotherapy bit, directly into the spider vein. Successful injection is confirmed by the displacement of blood in the vein, resulting in a visual phenomenon called blanching. After successful injections by microsclerotherapy, the leg spider veins will fade. For aesthetic clinic owners, adding microsclerotherapy to the treatments they offer is a great way to add a valuable revenue stream. So, who can perform microsclerotherapy? Microsclerotherapy requires training, skill, and practice. So if the injector is appropriately trained and competent, it really doesn't matter who the injector is, doctor, nurse, or non-medical practitioner, such as an aesthetician. The actual injection of sclerosant is only one aspect of treating leg spider veins by microsclerotherapy. Yes, it's important, but there are other important aspects, such as the patient is carefully assessed by history and examination. Account is taken of the indications and contraindications. The patient is carefully consented and knows the risks and benefits. The practitioner is able to provide appropriate aftercare. The practitioner can manage anaphylaxis, a very rare but very serious complication of sclerotherapy. The practitioner has access to advice and can refer for a second opinion. Aesthetic practitioners who are not medically trained can perform the injections, provided they work under the supervision of a health professional who prescribes the sclerosant after assessing the patient and who can provide oversight and clinical governance. Many business-savvy aesthetic clinic owners who are doctors and nurses train their aestheticians to perform microsclerotherapy. This way, they can leverage their own time by providing supervision without actually doing the microsclerotherapy injections themselves. Now, which parts of the leg with spider veins can be injected by microsclerotherapy? It's relatively simple to treat all areas of the legs, with one important exception: the ankle area. This ankle injection looks easy, doesn't it? And if you're properly trained, it's a bit tricky, but it's not that difficult. Nevertheless, there is a learning phase to microsclerotherapy injections, and not all of your attempts at injection will be successful when you first start off. So if you've only just started injecting leg spider veins by microsclerotherapy, I strongly advise that you don't start with ankle veins, no matter how tempted you are. Why? What's so special about the ankle area? Well, I recommend you don't inject the ankle area for 4 major reasons. The first reason you should avoid injecting spider veins around the ankle is that spider veins in this area are extremely close to nerves and arteries. So this area of the leg is particularly vulnerable to inadvertent and accidental injections into arterioles, sometimes even arteries, with disastrous consequences. So beware. The second reason is that even a little bit of extravasation of the sclerosant within the skin can cause prolonged sensory neuritis. That's painful. The hallmark of extravasation, skin blebs of sclerosant, are painful wherever you inject. Now, extravasation around the ankle can cause pain for weeks and months if a superficial sensory nerve becomes inflamed by the leakage of sclerosant, and this is much more of a problem and more likely to occur around the ankle because the sensory bundles are so superficial. The third reason is that small ulcers and scabs in this area can be very slow to heal. It's well known that the foot and ankle are areas of the body that are slow to heal anyway. They're much slower to heal than, say, for example, the thigh. So whatever cause of the injury, the ankle area heals very slowly. The fourth and last reason is that spider veins around the ankle are often associated with a condition called superficial venous reflux. In fact, the condition called corona phlebectatica, which is a cluster of spider veins around the ankle as shown here, may be the only sign of superficial venous reflux. And that's not just a cosmetic condition. The association between superficial venous reflux and spider veins is therefore greatest around the ankle compared to other areas such as the outer aspect of the thigh. Superficial venous reflux should be suspected in all cases where there are spider veins around the ankle, and in such cases it's important that superficial venous reflux is addressed before spider veins are injected. So for this reason alone, most experienced specialists will advise that patients with ankle spider veins should have a full assessment by a duplex ultrasound scan. Now, at the beginning of this video, I told you I was going to give you my number one tip to avoid microsclerotherapy complications. And it's to bend the needle. Now, as a beginner, the tendency is to inject too deeply. And that's why injecting around the ankle can be so dangerous. Around the ankle, the injections can be so deep that they go through the spider veins and completely miss them, hitting structures underneath. Therefore, I advise that as a beginner, you start off by bending the needle to 10 to 15 degrees, place the needle flat on the skin with the bevel up, and slide the needle forward so that your injections remain very superficial within the skin. And as a beginner, you will avoid the tendency to inject too deeply. Bending the needle will increase the injection accuracy and reduce the risks of microsclerotherapy complications. Now, in the description box below, there's a link to my free mini course, How to Inject Leg Spider Veins and Blue Veins by Microsclerotherapy, where you'll find more tips for successful injections. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel, and check out all the links in the description box below. Why not leave me a comment or a question? I look forward to reading all of these, and I promise I'll get back to you as soon as I can. I hope to see you again soon, so don't forget to hit the subscribe button, and that way you won't miss my next video.